So this is an investigator-initiated trial. So the University of Wisconsin being the sponsor of the trial. So the idea behind this trial is that, we know historically with metastatic melanoma with liver metastases that they actually have worse outcomes, both progression-free survival and overall survival. And we suspect that the liver metastases actually causes a very interesting phenomenon, sort of an immune systemic desert. And so really the unmet need is how can we sort of reverse or restore the normal immune system and allow the full body to actually respond to immunotherapy much more efficaciously. So Melphalan PHP is a study, investigational agent in the study, which is approved for metastatic uveal melanoma, but not for metastatic cutaneous melanoma. And so what our hope is that we're using this agent called Melphalan, which is injected by a percutaneous route to actually treat the entire liver so that if there is liver metastases, we might be able to sort of reverse the immune system status of the liver and restore a systemic benefit from immune checkpoint inhibitor. So for this phase 1b/2 trial, it's actually a combination of Melphalan PHP plus Nivolumab and Relatlimab, a commonly used first-line agent for metastatic melanoma. And the primary population that we're trying to focus on is metastatic non-uveal melanoma. So these include cutaneous, acral, and mucosal. And so we are in the process of actually accruing subjects right now at our institution, and we're always willing to accept new referrals.